I'm Dr. Melanie Tantisira, and today I am going to demonstrate the new technique of using the InstaLift threads. This new technique uses 10 threads instead of 6, and it also uses twice as many cones as the old technique, which produces a non-surgical facelift, which is almost as good as that of a surgical facelift. By avoiding surgery, we minimize the risks of surgical complications, such as scarring, numbness, and prolonged healing. If you're not familiar with this technique, it uses long threads made of a material that is compatible with the body. Multiple cones are attached to the thread and are used to fixate the skin in the position that is higher and lifted. So now I'm going to go ahead and demonstrate the actual procedure itself. First, I mark the complicated vectors for each thread that I will place so that I can maximize the lifting action of those threads. Next, I completely numb the entry and exit sites where the needles will penetrate the skin. Here, I am placing the first needle just under the dermis, and I will be placing it in an upwards direction. The upper half of the threads are meant to stabilize the skin on the upper part of the face so that it does not move downwards. And now I am placing the other half of that thread in an inferior direction. Here we are working on a completely vertical thread. That thread will be directed downwards towards the jawline, and you can see here that we place it right through the scalp. And I'm pulling that half of the thread in. And now we will work on the second half, which will go down towards the jawline and will lift the jaw and make it nice and crisp, and there'll be absolutely no sagging in this patient's face afterwards. As I place the thread, I can guide the needle with my fingers and make sure it goes exactly in the direction that I have drawn. And I can actually feel when it's about to come out, and I can plan the exit site and bring it out exactly where I need it to create the maximum lift right at the jawline. So this patient will have a very crisp jawline. And now I am treating the marionette area. This is a real problem for some patients. And once we've gotten that thread out, there's just one more to do. This is the second to the last thread. We will clean her up, tighten her skin over the threads that have been placed on her skin. And then after tightening all the threads, as much as it looks like she needs, you can see her really lifted face. She's not allowed to smile. That's against the rules, as the cones must be fixated where they are meant to be.
Thank you for visiting Dr. Melanie Tantisira's presentation.